Chatham Journal. I'm here at the First Health Lung CR, is it CTR? Correct me.
Lung bus, so low-dose CT scans.
All right, and we're standing here in front of it. Josh, can you tell us what goes on here?
Yeah, so essentially what we're doing with the lung bus is we are creating a way to reach our more underserved populations in rural areas who don't have the same access to low-dose CT scans. So by having this lung bus, we're able to go out, engage with the community, and increase screening rates and hopefully move up the staging of lung cancer. So this right here is the low-dose CT scanner machine that we have, and this will allow us to hopefully catch cancer earlier, move it to stage 1 or 2 where it's identified, so we have a much greater likelihood of people making the full recovery and surviving. So that's kind of our goal with this, to increase that access to cancer screenings and hopefully improve outcomes.
All right, I heard you mention you have to get in, you have to sign in, that process takes a little bit of time.
Yep.
But what's involved, once I walk in here, what's the process, what's the involvement, how much time are we talking about?
Sure, so for the process, really, you'll have people do registration when you first set up here. We have a lung bus coordinator that'll help facilitate all that process. Registration is the lengthiest part of the process. To your point, can take 15 minutes or so. Once you get in here, it's 10-15 minutes tops for the actual low-dose CT scan. You'll have a CT tech who's actually running the machine, making sure they walk the patient through what to expect. But the procedure and the scan takes only about 10-15 minutes.
All right, now, is the machine moving? Is that unit moving, or this moving, or how does it scan me? Do I lay down with my head over there? Or do I lay down with my head over here?
Great question. So what you'll do is you will lay down head this side, and it will actually lift the table up and pull it through the machine to do the scan.
All right, so I would start off here, and I would go through here.
That's correct.
And that's when it would do the scan.
Yeah, this section right here is actually where the scan's performed.
So I assume my lungs are going to land up somewhere in this vicinity.
That's correct.
All right. Now, once I run that and you complete the process, you roll me back out.
That's correct.
And then when do I find out about my results?
So result times, basically our goal is to be able to get those to patients as soon as possible. That varies a little bit just how long it takes the study to get read. But the goal is within a matter of days to be able to get back in touch with the patients to let them know the initial findings of the study. So that way they are not waiting on that. Obviously that's an anxiety-inducing experience to wonder if you do have cancer or not. So again, exact time frame, I can't give you that, but we do have a team that helps streamline that process to get results to people as soon as possible.
All right, so if you happen to find something, then you'll reach out to the patient and recommend a...
Correct. So we have a provider, actually Christine McBride, who's going to be our facilitating the lung bus as a physician assistant. She'll be overseeing the orders, placing those, making sure the patient follows with a PCP for those folks that actually do have a primary care provider that is established. For those who don't, she'll actually coordinate with them to make sure they establish with a primary care provider for follow-up. And anyone who there's an abnormal finding would be referred to our chest center and work with the oncology team to make sure that they can do proper follow-up and get them taken care of in a timely manner.
All right, and you mentioned this is a portable unit, so not only can you hook into power, but you can also generate your own power. Is that correct?
So there's a self-sufficient generator that we have that can run for, really get us through a whole day of scans, an 8-hour day of scanning, no problem. Can realistically run for probably close to 2 days. We also have the ability to hook up to shore power, so if we are in somewhere where there is a hookup for the unit, we could just plug in versus having to run off of generator power.
All right, anything else folks need to know about this, Josh?
The other thing I would say is just that this is really a part of our comprehensive effort to expand access to patient care. For anyone who there are findings, we would obviously refer those down to our Comprehensive Cancer Center in Pinehurst. That just celebrated 1 year of operation and really trying to, with the Comprehensive Cancer Center, bring all of the care involved in cancer patients under one roof, right? So traditionally in hospitals, you'll see 3 or 4 different locations where cancer care may be from infusion to radiation oncology and so on and so forth. By combining all those into one facility, it creates a one-stop shop to make it the best experience possible for a very difficult time in patients' lives. So.
Gotcha. Thank you very much, Josh. We are out of here.